Assalamu alaikum everyone. This is Mohammed Rashid from الجيون Foundation and the American Accreditation Commission International as a part of our community service programs this year, where we talk about national and international healthcare topics with a select of highly intellectual professionals from the UAE. Today, we'll be talking about Cancer Awareness Day with Dr. Abdulrahman Al Kinge from NMC Royal Hospital. Dr. Abdulrahman is the head of the Hematology and Oncology Department, and he's an assistant clinical professor in the University of Sharjah. Thank you so much, Dr. Rahman, for joining with us. And I hope that you can give us a couple of tips and useful information about this topic.
Thank you, Mr. Muhammad, actually, for sharing this information and reaching out to our community. Now, what we're talking today is about the World Cancer Day, which should be on February 4 of every year. And this day should remind us of our beloved ones, our relatives, neighbors, friends, and community who are suffering or suffered from cancer. Now, as we all know that every type of cancer has a specific day or a specific month of the year where we launch campaigns and awareness campaigns to help the community to be aware and active about this subject. But this day, we use it to remind ourselves further and make focus more when we put all these cancer types in one basket and we reach out to our community to remind them how much awareness is important, and we can emphasize further on giving the right information for our beloved ones in our community and society, as well as guiding them in the appropriate support in order to succeed, to prevent, as well as early detect the cancer. Now, this is a day that is very important because we can share information and we can start telling you about what happens in the world as well as our beloved country, UAE here. We can start by sharing with you what happens in the statistics in the world, how much cancer is being affecting. Now, in 2020, we have to know that about 20 million people had new cancers. This is a huge number in 1 year, and this number is actually on the rise. This is without forgetting that during the new diagnosis of these 20 million people, there's actually another 50 million people in the world suffering or being treated of cancer at the same time. So in 2020, we had around 70 million people having cancer. So we do to see the impact of the magnitude. Now, unfortunately, in 2020, the numbers expected of the cancer-related death about 10 million people. So you have 10 million passing away, dying from cancer in 2020. This is a huge number. Now, the most common cancers in the world, it's still until now is breast cancer. It is a bit higher than lung cancer, but it is still breast cancer is being number one as the most common cancer in the world. Lung cancer comes next, and then colon cancer comes after. Now, regarding you got dividing between genders, in the males, mostly lung cancer is more common, then comes the prostate cancer, and then after that is the colon cancer. In the females, on the otherwise, the most common cancer is still breast cancer, about 21% of the cases. And you can gather that about 12 million people having the issue of breast cancer. So the impact on our society as worldwide is clear. Now, talking about this is incidence, if you talk about the mortality, the cancer-related mortality, you can see that worldwide, lung cancer is being number one as causing death from this. Now, we know that cancer in general is the second common cause of death worldwide in the developed countries, but in the developing countries and the third world countries is the third most common cause of death. And this is something that should be tackled on a daily basis among the physicians, as well as the government, as well as the society and individuals to take care of this topic and to always focus that cancer can be prevented and we can early diagnose to improve our numbers. And this is what we're going to discuss later on. Probably going to ask me right now regarding the UAE numbers. What do we have? Now, we have significant number of cancers happening on a yearly basis. They expect the approximate number is about 5,000 cases per year, but we have to put in mind that in addition to these 5,000 new cases diagnosed yearly, and we're expecting these numbers to rise, we have 14,000 in the UAE suffering of cancer at the same time. So you have around 20,000 people in the UAE in 2020 suffering of cancer, of any type of cancer. Now, the rate of death is actually about 2,000 people dying from cancer every year. And we're hoping that we can follow the United States model, where the death rate now it is decreasing. The most common cancer in the UAE is breast cancer. It is 25% of all cancers, breast cancer. And our beloved ladies in the communities, our family, our mothers and sisters and wives and daughters are having the largest number of cancer in our society. And this is something that is really sad. This is really something sad. And I know we can do something about it, Mr. Muhammad. We can do something about it. In males, the most common cancer is actually colon cancer, and then you follow up by prostate cancer. But in general, the most common cancer in the UAE is breast cancer. If you take it into if you take it only as the gender of females, look at the numbers. In the world, in the females, 21% is the rate of breast cancer. In the UAE, the numbers are reaching almost 40%, almost double the number than the world. This is something that, as percentage I'm talking, you see the impact. You have 40% of our women affected with breast cancer. 40% of the case of cancer, 40% are actually women. So this is something that we have to really take into consideration. Furthermore, that regarding, when I focus on the breast cancer, because this is a really a social stigma in our culture, our ladies get the cancer at an earlier age. The mean age diagnosis in the world, or mainly the Western world, is about 54, 55 years of age. Our ladies of the community, they get the cancer at a young age, 10 years younger, about the age of 45. And we do not know why our ladies in the community are getting the cancer at a younger age. This is something that we discuss, and I think you mentioned. Yeah, go ahead.
Doctor, I think it has some reason due to the fact that the demographics of the UAE, I mean, most of the population here are youngsters. I mean, it's not like other countries where you have so many old people actually, because there are so many expats in UAE. So basically, they're all younger in age. The demographic itself is a young community. Maybe that's one of the reasons why these rates of younger people with breast cancer is much higher than other countries, I think.
It may be, but we have to take into consideration that it's not only in the UAE, it's mainly in the Arab world. You see it in Lebanon, you see it in Saudi, you see it in Egypt, where actually it doesn't mean the expats are not more than the nationals. So this is something related to the Middle Eastern culture. It could be on the genetic basis, though we know that our community, the ladies in our community, they get children at a younger age. They breastfeed more, so they are more protected, but still we do not have a full explanation why our females get the diagnosis of cancer at a younger age than the Western by 10 years. Now, there's many speculations, many thoughts, but probably the one of them is probably the obesity. Probably we have a higher rate of overweight and obesity. It could be. I don't say this is the cause, but it may be.
Well, but again, I think as per the World Health Organization, they say that obesity and smoking is basically the top two reasons why people get cancer, regardless of what type. This comes as, well, obviously these are statistics, but what I have learned is that especially breast cancer is something that is easily preventable, and also early screening for breast cancer is going to do so much help when it comes to treatment as well.